St. Mary's Volunteer Community Clinic opened its doors in the year 2000. A group of concerned health officials and volunteers established the volunteer clinic in response to patients whose medical needs were not being met by other means.
The volunteer clinic originally started in the year 2000, and I was approached by a community member expressing the need for a medical service for individuals who have no medical insurance whatsoever.
At the end of last year, I was no longer able to work due to ankylosing spondylitis and some other autoimmune diseases, so I lost my insurance. My medications are extremely expensive, and I need them to help me not have the disease progress anymore and also to maintain symptoms.
We do a lot of kind of chronic medical management for things like high blood pressure, high cholesterol, adult onset diabetes mellitus, emphysema, a lot of minor infectious things like upper respiratory infections or sinus infections or ear infections.
It's a very basic medical care that we provide, but the benefits is those people who have no insurance are going to get their basic care needs met.
We cannot do things that require a lot of intensive workup or care, like if someone comes in with chest pain, that might be a heart problem, we send them to the emergency room because we just don't have the ability to diagnose and treat those.
We can serve any age as long as there's no Medicare, Medicaid, or health insurance involved. So we have seen infants that parents have brought in because they're not on Medicaid and the parents had no insurance for that child.
Before receiving service, patients must go through a screening process to determine eligibility and cost.
Minors would need to be accompanied by an adult because, number one, there is a financial screening involved, and that financial screening, they wouldn't know the answers to any of those questions as far as family household size and income, and it goes by the income of the whole family. So minors would need to be accompanied by an adult.
We have a sliding fee scale that the patients that come in ranges from $1 to $10 based on the amount of people in their household as well as their monthly income.
Well, I wouldn't have been able to get the blood work necessary for the doctors to okay my medications without the program, and I wouldn't have some of my basic medications at all without the program.
We have what we call a prescription voucher that once the patient, whatever they come in for their services for, if they need a certain type of medication, of course we don't do anything on behalf like of narcotics, but that service voucher is then taken to our local pharmacy to be filled there and at no charge to the patient.
And our pharmacy and our hospital has been very supportive as far as the pharmacy does our voucher system for the medications for the clients, and our hospital is very gracious on doing labs free of charge for our clients. So,
How can you help? Although there are many donated services, costs for purchased pharmaceuticals, payments for diagnostic evaluations, and medical supplies pose a sizable expense for the volunteer clinic to operate. To cover these costs, the volunteer clinic depends on donations.
hopefully we can still keep our doors open. It does all depend on the volunteers, and it depends on people's donations.
We are located in the Penn Adult Health Building. They can drop their donation off here as well.
And if there's anybody out there that wants to volunteer, we'd love to have you.
Just the doctors and nurses have been wonderful and supportive and helpful in a time that's been very, very difficult for me.